Hi, I'm Dr. James Dowdell. Welcome to the right tool for the right job, choosing and using topical hemostatic agents in hospital outpatient departments and ambulatory surgery centers. This CME initiative is supported by an educational grant from Pfizer Inc. This is the second of three CMEO snacks, and we'll cover preparing topical hemostatic agents for use in hospital outpatient surgery center departments and ambulatory surgery centers. Again, I'm Dr. James Dowdell. I'm an assistant attending orthopedic surgeon at the Hospital for Special Surgery, where I work in spine surgery. And with me again is Michael Capito, a perioperative nurse with Hospital for Special Surgery in New York City. Welcome back, Michael.
Thanks, Dr. Dowdell, for including me in this initiative.
Here's our learning objective for today's program. After participating in this activity, learners should be better able to prepare topical hemostatic agents for use in the outpatient surgical environment. So in a moment, Michael is going to take us through the steps in preparing specific topical hemostatic agents. So first, let me offer some global comments on collaborative planning and coordination. The interprofessional team consists of surgeons, anesthesiologists, nurses, and technologists. Now, ultimately, the most important thing is that everyone on that team feels that they are part of a team, that there's respect in the room, and everyone feels that they can speak up, because it's everyone's responsibility in the OR to maintain sterile environment, coordinate patient care, and anticipate equipment needs. What does that come down to? The patient in the room is everyone's responsibility. So there are some general considerations for preparing topical hemostatic agents, and ultimately, we want to make sure that there's safe management of the sterile field. We want to follow the manufacturer's instructions for the storage and preparation, and we also want to prevent us from using expired products, right? There's expiration dates on the box that we use before we prepare it. Michael, did I get that right?
Absolutely. Every single one of those are very important, from checking the expiration date to proper preparation of these products.
Now, ultimately, how many times have you put a product on or tried to open a product and have that product be expired, but because you've checked it, it hasn't impacted the patient?
I actually have been very lucky to not ever have seen an expired product in my situations, but maybe something pretty close to expiration date, but always within,
So I think that boils down to
Yeah.
HSS's quality checks. I think that's important, right? We're checking these products on the back end. So that doesn't just mean the team in the OR, it means the team that's stocking everything as well. Now, some specific examples of prepping hemostatic agents for surgery.
Thanks, Dr. Dowdell. Let's start with a few simple out-of-the-box solutions. So I say out of the box, these things are just ready to go once you open them up. One I could focus on in particular is Surgicel. So Surgicel comes in various forms. We have the original, we have a version called Vibrillar, another called Snow, and another Nunit. Where I work, we mostly use Nunit, and I've seen Vibrillar also used. Now, all four of these have various applications, and depending on the situation you're in is what you're going to want to bring out for surgery, basically. You can manipulate these things. You can cut them up and whatever shape or size you need them for, so basically for the surgeon to use in the particular situation that they're facing.
So typically, I'm going to jump in for a second, Michael. I use Vibrillar sometimes in pedicle holes. I'll cut it to the shape of a pedicle, and I'll shove it right in the pedicle, so we prevent bleeding from that cancellous bone in the pedicle. I don't like to put flowables in that if I can avoid it. And the concern I have about a flowable is if you have a cortical breach somewhere, that flowable can get into an area you don't want it to go. Nunit, I'll typically use that as my Surgicel of choice in laminotomy defects, and when I'm trying to put a flowable into cancellous bone, different cancellous bone than the pedicle, right? I'm talking about a laminotomy defect where it's a very controlled segment of space. So, Mike, why don't you go into some flowable preparations now?
Sure. What you're going to need to, before preparing the Gel Flow NT, you also require thrombin JMI. When you open the package, you will see a vial of sodium chloride. You'll see the actual thrombin, another vial. You'll have a transfer device, a sterile syringe also. So what you're going to want to do is pop off the tops of both of your vials. And then what you're going to do is you want to connect this transfer device onto the luer lock end of the syringe. Okay, so you're going to take this and you want to put it on a flat surface, and you want to puncture the top of the vial, and you want to go at a 90-degree angle. quick tip from what I've experienced. You don't want to go in at an angle at all. What happens with that is cause some problems later. Sometimes you won't be able to draw it up, or you won't be able to transfer it later. But just keep in mind, always try to do it at a 90-degree angle. Otherwise, you'll run into problems later. So from here, you just drop the saline. It's about 5 cc's. Okay, and what I like to do is I like to bend it, take it off. You keep this end sterile, and you want to puncture the other side. Okay, and so in here is powder for thrombin, and what happens with that? If you saw right there, it automatically sucks it down. If the powder isn't completely dissolved as fast as you'd like, what I like to do is swirl it. Ideally, you don't want to shake it, causes a lot of bubbles, and you won't be able to get all the product out later. And from here, you're going to draw it up. Okay, and make sure to pull back on the plunger, otherwise it's going to suck right back in. And then you're going to twist it off and connect to this device, which we'll use to transfer into the gel flow NT. Okay, so NT. All these products you're going to want to open up onto the sterile field. Yeah, always check your expiration dates prior. There we go again. Double packaging. Great. Okay, so here we have all our items from the gel flow NT packaging, along with our prepared thrombin that we're going to connect it with. These are applicator tips that you can use for later. So gel flow NT already comes with its own connector. What we're going to do is just screw that on. Make sure it's nice and tight, and you're going to mix the mixed thrombin already in with it. And you're going to go back and forth about 6 or 7 times. It's a little tough, but just keep going and start loosening up. Almost there. Okay, great. And when that's done, just unscrew the transfer device. And we're going to want to connect one of your tips. Great. So you have the malleable white tip. And the beauty of this is you can actually cut this to the length that you want to use it. Ideally, you want to cut it squarely, so that way you don't create a point to accidentally injure the patient when they use it. And that's how you prepare gel flow NT.
Well, very good. And ultimately, I want to jump on 2 points that he made. Number one, that tip is malleable, right? So the important thing about that is I can get into areas where I typically wouldn't be able to get to without a malleable tip, right? I can angle it. Specifically, I do minimally invasive surgery. I use a tube. I want to be able to angle the malleable tip into areas that I normally wouldn't be able to access. Number two, when you're cutting that, right, you don't want to create a sharp point. You create a sharp point. Well, what happens with that? I can injure the dura with that. The dura is a very thin structure. If I have a sharp point on anything, I can create a tear in it. So you want to have a square angle. Now, typically, I don't like them to be cut because they still create sharp edges. So I like to do uncut. I'd rather have a longer tip than a cut edge near the nerve root and dura. I think that was a great demonstration, Michael. So what we can do is we can compare another similar product called Surgiflow and see the difference between comparing and preparing these two products.
Next up, we have another flowable, Surgiflow. This is one we typically use over here at Hospital for Special Surgery. Inside are the 2 parts that you're going to need. You need the Surgiflow, the gel part itself, and the thrombin. Okay, so the actual thrombin part can actually be prepared off the field, but you can also pass it onto the sterile field for the scrub person to prepare. And this part, with the actual gel, you're going to want to, that's the one you're always going to want to put onto the sterile field automatically. So I'm going to start off with the thrombin. Inside, you have a pre-filled syringe with saline. You have your thrombin vial. And you have your vial adapter. So, pop off the cap. You open up the vial adapter, but what I like to do is I always like to hold on to the plastic container that it's in as to prevent contamination. and you want to make sure that the point inside does not get contaminated. And so you put that once again on a flat surface on top of the vial, puncture the top, and uncap the pre-filled syringe. And it screws right on top. And just introduce that to the powder inside. And like I said, I like to give it a little swirl to prevent bubbles, to make sure you get all the product. And once that's all absorbed, draw it right back up. And this is ready to transfer onto the sterile field. So in the event that you are giving this to your scrub person as a circulator, we have the SurgiFlow has this little dish on the inside that they'll place on the sterile field. And this is where you're going to transfer the thrombin for your scrub person to pick up. Now, inside the packaging for the inside the other packaging for SurgiFlow, you have the gel, you have an empty syringe, and then you have the applicator tip. So now we're on the sterile field. Your scrub person receives the thrombin from the circulator, and your scrub person will draw it up into the syringe. It's got every drop. Okay, and unscrew the end of the gel syringe, connect them together. Just like before, you just want to mix it up together about 6 times. Disconnect and screw on the applicator. And that's how you for SurgiFlow.
So Michael, thanks for those demonstrations about gel flow, NT, and SurgiFlow. We also use fibrin sealants at HSS. One of the ones that we use is called Topical. It's a 2-component system that contains human fibrinogen in one container and human thrombin in another. They have to be separate because when they come in contact with each other, they create their own clotting cascade, essentially. So can you go over the preparation for Topical?
Sure. One of the big considerations before you even get to sales, you want to make sure that the timing is going to be correct. You want to order it well in advance to preparing it, because the product's to be thought out. So as soon as a surgeon communicates with you that they want the to seal, you're going to want to order that and make sure that you have everything ready to get that thing thought out, ready to go. So you want to make sure that you have a sterile water bath on the sterile field. That way to help thaw it out, so that by the time he's ready to use it, it's ready to go. So what you want to do is, once it's all thawed out, you want to snap and lock together the syringe, and there's a tip, and it'll go on together. And once you connect that, it's pretty much ready to go.
There are various tips available, Michael. The MIS and endoscopy, obviously don't use endoscopy. MIS surgery, we could potentially reach harder to get places with the MIS tip. I typically don't use it. And now ultimately, the way I spray a fibrin sealant, it's important, is I don't want to put it right on the wound. I want to actually step a little bit away because it works by integrating with itself. So you don't want to put it right in the area of concern. You actually want to spray it from up above. So I think that's an important component to any fibrin sealant. You kind of want to pull away from the patient a little bit and just spray it like a gas, essentially. So thanks for the excellent demonstration discussion, Michael. Let's conclude with a few SMART goals, which are action items for you, our audience, to apply in practice. So number 1, you want to involve the interprofessional team when planning for perioperative hemostasis. Number 2, you want to anticipate the needs of the surgeon and time needed for preparation and administration of the hemostatic agents. I think Michael touched on this specifically with the fibrin sealants. And number 3, you want to follow the manufacturer instructions for safe storage and sterile preparation of topical hemostatic agents. We do this very well at HSS. And like Michael said before, we've never really run into issues where there's been expired products or products that are in disarray, but it's very important. So thank you, Michael, and thank you to our audience for your attention. If you haven't already viewed them, be sure to check out snacks 1 and 3 in this series, now available at www.cmeoutfitters.com, and be sure to fill out the evaluation and post-test to receive credit for today's activity. Stay safe, everyone.